Hi folks, Marty Morales here, certified rolfer and bodywork instructor, and today I want to talk a little bit about spinal mechanics. Spinal mechanics comes from Fryette's law, which states there is rotation in side bending. And what I put together here is a little model that I use in my workshops to illustrate the Fryette's law and to illustrate that there is rotation in side bending. Most notably, there's rotation in side bending with regards to the spinal column. So different parts of the spinal column will rotate when they side bend. They will rotate differently. And here I put a model for the cervical spine. So this represents cervical vertebrae 1 through 7. So C1, 2, 3, 4, 5, 6, and 7. And this is the spinous process, and these two here are the transverse process. So with regards to the cervical spine, this is the spinous process. The client's head would be facing this way, so this is a posterior view. With regards to the cervical spine, when the client side bends towards the left, then we say that there is rotation, and there's rotation counterclockwise. So when they side bend towards their left, there's rotation counterclockwise with respect to the vertical axis. So if you're looking at it from the top down, then these vertebrae will actually rotate counterclockwise. When the client side bends towards their right, then there will be rotation clockwise. In its most basic understanding, that's what's happening. C1 is a little different. I won't go into it right now, but in general, that's what's happening with the cervical spine. So what we do in the advanced neck workshop is we say, for example, let's say a client has a rotated vertebrae. Let's say they're in a neutral position and yet one of these vertebrae are rotated. And that can actually inhibit range of motion, which it does a lot. They may not be able to side bend one way very easily or be able to rotate one way very easily. So what we say as body workers is if we palpate a rotated vertebrae, then we can work the soft tissue and assist with movement in order to derotate rotated vertebrae and allow the vertebrae to find its way back into a neutral position. So that's one of the things we cover in the advanced neck work workshop.